I'm Wade McKittrick, Superintendent at Montevideo Public Schools. The creation of the Montevideo Medical Academy really, it came out of need. It was a fun conversation one morning where I was having coffee with a couple of our folks in town that work with our long-term care facilities. And they were sharing that in their world, they're really short workers. But then the follow-up question was, how can you help, Wade? How can the school help? I didn't have an answer. I didn't know, quite honestly. It's not just the school that needs to help. It's our community. It's our healthcare community. It's our professionals. It's our school. We need to partner together, and we need to get outside of the box. I got members from CCM Hospital, from Private Industry Council, from the Council for the Center of Aging Community. And we sat down and started talking about what would help, what would be of assistance. What if kids were able to have an experience inside of the school walls to take away the barrier of having to leave the school campus? But what if that experience was in school? And what if that experience allowed for kids to get college credit taking courses inside of the school? What if those courses led to certifications? What if those credits led to filling jobs within our community that maybe would incentivize our kids to stay here? What if those courses expose kids to the possibilities of what Montevideo as a long-term life community for them had to offer? CCM Health was absolutely a tremendous partner. They were able to come alongside us and guide us in some of the professional pieces of here's what we need in our industry. But then they came alongside us and said, you know what, we're going to take care of the financial side. We're going to get you beds for the kids to practice on. We're going to get the mannequins. We're going to get this. We're going to get that. And by the way, if you need people to help to come in and speak, we'll free up our professionals. Our long-term care facilities jumped in right away and said, hey, if you need places for job shadows, you need places for kids to come and get experiences, you need our staff to come and explain things for you, we're all in. And this partnership really started to unveil itself.
Hi, my name is Katie Bierhansel, and I'm the career coordinator at the Montevideo High School. And I became involved with the Montevideo Medical Academy when we started talking about putting the class together, how it would run, and bringing in partnerships to our class. CCM Health was big in getting us professionals in the field and getting the supplies that you see in this room, the beds, the mannequins, and what we would need to go through the CNA skills training. And with the LYFT grant, we were able to purchase things like the students' textbooks. We purchased scrubs for them all so they go out in the community looking the same during their skills practice. We also were able to purchase college credits for them. So our class is set into 3 levels, level 1, level 2, level 3, and within each level, students will obtain different certifications in the medical field, and they will be able to earn college credits in each of those levels, totaling 22 credits if they were able to get through all 3 levels. We created this class because we wanted students to build a foundation for any future medical career. Beyond that, they'll complete the CNA portion, a certified nursing assistant, so they'll all have the chance to become certified nursing assistants and hopefully work right within our community as they finish the program. And then if they go on to level 2, they'll be able to complete a TMA, so coursework that would allow them to be a trained medication aide in a facility, and then a body structure and function class, which is a foundational anatomy class for nursing programs and beyond. Students that want to move on to level 3 at this point would be a pharmacy technician rotation, where they would end their high school career with a pharmacy technician certification, be able to work right out in that field. Part of that would be an internship in the community as well. Last year when we had 26 students starting, 9 of them already are working right in our community with our local healthcare organizations, filling that need for CNAs. Many others are looking at going on to doctorate programs. Some are staying at a CNA position. Some want to move into registered nursing and into various fields in that.
So it started off with semester 1, we did a CNA program, and then we moved into a CPR and first aid section of it. And once second semester rolled around, we had 1 quarter dedicated to our TMA process, and then our 4th quarter was our medical terminology process. and that would just give us a base and a foundation for what we know in the medical field.
I wanted my CNA because I want to go into nursing.
So I had a lot of interest in the medical field to start, but I had no interest in getting my CNA. But getting it was good, and learning it and all the stuff with it was good. The coolest part for me was getting to work in the lab here. We have a bunch of mannequins, and we got to try our skills on the mannequins, and that was fun, getting to be with another classmate to work on it and learn how to do the things hands-on was fun.